Hello, and thank you for coming to our website. I am Dr. Miguel Rodriguez from Miami Gastroenterology Consultants, and I'd like to review with you some concepts about irritable bowel syndrome. This is an entity that affects a large number of individuals, equally divided among men and women, although there is a perception that more women are affected by it than men. But research shows that affects both sexes equally. This disease characterizes multiple symptoms and conditions affecting the gastrointestinal tract from the mouth all the way to the rectum. Patients can experience this irritation or acid indigestion, bloating, increased gas, burping, constipation, diarrhea. Occasional can be even fever or bleeding. All these conditions occur at different times and may have different triggers. Some people the symptoms can be triggered by foods such as dairy products or certain fruits or vegetables. Other individuals these conditions can be triggered by viral infections. And once they are present, they last for a long period of time, and they can affect the quality of life of the individual. Among the most common symptoms, as I mentioned, include bloating, difficulty swallowing, acid indigestion, increased flatulence, increased burping, very noisy intestinal sounds, constipation, alternating with diarrhea, occasional blood, and all these symptoms tend to present at different stages and cause different complaints from the patients. Most commonly, we tend to see episodes of constipation in which the individual can go for several days without bowel movement and they tend to use laxatives chronically. This condition can also manifest with diarrhea, or if not diarrhea, increase frequency of bowel movements. These bowel movements will appear normal, and it will just be triggered by eating or even by drinking some water. There is also the condition in which the patient will experience significant abdominal pain in different areas, most commonly surrounding the belly button, right over in the center of the abdomen, over the area where the liver and the gallbladder are, or in the lower part of the abdomen. Many of these conditions can mimic a gallbladder attack or an episode of diverticulitis or peptic ulcer disease. When I see a patient with which I suspect that irritable bowel syndrome is part of the picture, my first goal is to make sure that no other clinical condition exists. In my opinion, irritable bowel syndrome is a diagnosis of exclusion, and more serious digestive diseases must be excluded before the diagnosis of IBS or irritable bowel syndrome is made. These patients will have a complete physical examination and will have additional diagnostic studies depending on the clinical presentation. They can include endoscopy, laboratory studies, evaluation for inflammatory bowel disease, as well as food allergies. If you need additional information, please visit our website at www.miamigastro.com, and I thank you for your attention.